Pediatrics Clinical Rotation for 9th semester students of the Faculty of Medicine. The Pediatrics Clinical Rotation in the 9th semester aims to provide students with a comprehensive understanding of the management of infant, child, and adolescent health. This rotation combines theoretical learning and hands-on practice in handling various acute and chronic health conditions in the pediatric population. 1. Objectives of the Pediatrics Clinical Rotation. Clinical competencies. Understanding normal growth and development according to age. Identifying and managing acute and chronic pediatric diseases. Educating parents or caregivers about disease prevention and child health management. Procedural competencies. Performing basic clinical procedures on infants and children, such as blood sampling, IV line insertion, and neonatal resuscitation. Communication and collaboration. Developing communication skills with children, adolescents, and their families. Coordinating with multidisciplinary teams, including nurses, nutritionists, and specialists. 2. Learning structure and daily activities. The Pediatrics Clinical Rotation takes place in inpatient wards, outpatient clinics, emergency rooms, and pediatric intensive care units. A. Ward rounds activities. Reviewing the condition of hospitalized pediatric patients, such as those with pneumonia, severe diarrhea, or febrile seizures. Discussing treatment plans with the medical team. Objective. Understanding the clinical course of pediatric diseases and holistic management. B. Pediatric outpatient clinic activities. Examining outpatient cases with health issues such as upper respiratory tract infections, allergies, or developmental disorders. Administering immunizations according to the national schedule. Objective. Developing diagnostic and therapeutic skills for outpatient pediatric cases. C. Pediatric emergency room activities. Managing pediatric emergencies, such as severe dehydration, septic shock, or status epilepticus. Providing initial stabilization before referral to the ICU or inpatient care. Objective. Understanding triage and rapid management in critical conditions. D. Pediatric and neonatal intensive care unit, PICU, NICU, activities. Observing and assisting in the care of critically ill patients, such as those with neonatal respiratory distress syndrome, RDS, or neonatal sepsis. Learning to use support equipment, such as ventilators and incubators. Objective. Understanding intensive management of critically ill pediatric patients. 3. Diseases and conditions covered. This rotation addresses various diseases common in infants, children, and adolescents. Organized by body system. A. Respiratory system key diseases, pneumonia, clinical diagnosis and appropriate antibiotic therapy. Asthma, management of acute attacks and long-term care. Skills: lung auscultation and oxygen management. B. Digestive system key diseases: acute diarrhea with dehydration, oral and IV rehydration and complication prevention. Malnutrition: clinical diagnosis and nutritional therapy according to severity. Skills: assessing hydration status and administering IV fluids. C. Nervous system key diseases: febrile seizures, diagnosis, complication prevention, and parent education. Bacterial meningitis, initial management and antibiotic therapy. Skills: performing simple neurological examinations and interpreting lumbar puncture results. D. Endocrine and metabolic disorders key diseases: type 1 diabetes mellitus. Managing diabetic ketoacidosis and insulin therapy. Congenital hypothyroidism, early diagnosis and hormone therapy. Skills: interpreting thyroid function and blood glucose test results. E. Infectious diseases key diseases: dengue fever, managing dengue shock and close monitoring. Measles and its complications. Skills: intensive vital sign monitoring and IV fluid administration. F. Growth and development disorders key diseases: autism spectrum disorder, identifying early signs and educating parents. Delayed motor development, early detection and referral to physiotherapy. Skills: conducting developmental screening using tools such as KPSP or Denver 2. 4. Clinical procedures mastery students are trained in performing various procedures commonly required for infants and children. Basic procedures: capillary, venous, and arterial blood sampling. Peripheral IV line insertion. Nutritional and hydration assessment. Advanced procedures under supervision. Neonatal resuscitation with respiratory aids. Lumbar puncture for central nervous system infection diagnosis. Pleural or peritoneal fluid aspiration for specific cases. 5. Learning methods. A. Bedside teaching, direct learning from pediatric cases in wards under the supervision of clinical instructors. B. Case discussions. Students present clinical cases, including history taking, diagnosis, pathophysiology, and patient management. C. Clinical simulations practicing neonatal resuscitation and pediatric emergency management using simulation dolls. D. Observation and participation observing and assisting in diagnostic and therapeutic procedures in inpatient wards or the NICU. 6. Assessment during this rotation covers various aspects. A. Daily evaluations, participation in ward rounds, case discussions, and clinical activities. Proficiency in history taking and physical examination of pediatric patients. B. Mini-CEX direct assessment of practical skills, such as neonatal resuscitation or IV line placement. C. OSCE simulated skill exams for pediatric cases. D. Logbook documentation of patient cases handled and procedures performed during the rotation. 7. Challenges and opportunities. Challenges. Children are often uncooperative during physical examinations. Communicating with parents, caregivers requires empathy and specific skills. Opportunities. This rotation offers unique experiences in managing pediatric patients, requiring a distinct approach from adult patients. Students learn the importance of early detection and complication prevention in pediatric diseases. Conclusion. The Pediatrics Clinical Rotation is a vital phase in medical education. Students gain insights into diagnosing, treating, and preventing diseases in infants, children, and adolescents while developing effective communication skills with pediatric patients and their families. This experience lays a solid foundation for future medical practice.